Healthcare reform that was recently passed by Congress and recently signed by the current president involves a lot of changes in how healthcare will be delivered for the consumers. Some of these changes are good, such as helping the uninsured get insurance. However, some of these other changes are going to have some serious repercussions. One of the changes in the healthcare bill right now that's being established is the establishment of ACOs, or Accountable Care Organizations. ACOs are going to promote the team approach to providing healthcare. So when a patient comes in to see a doctor, they may not always be seeing the actual doctor. They may be seeing a nurse or a nurse practitioner, or they may be seeing a dietitian or a counselor. And in some aspects that may be considered good. However, we lose that personal touch and care will be much more fragmented. The current health care reform package does involve quality measurements, and this is actually a very good thing. Doctors and hospitals are now going to be paid based on quality measures. The difficulty with this, and one of the issues at hand, is that quality measures from this standpoint refer to having sick patients from getting sicker. An example, patients with congestive heart failure tend to be admitted frequently into the hospital because doctors in the office setting aren't properly taking care of them. So readmission rates for these congestive heart failure patients will be measured. The hard part to this is that in no place in healthcare reform do we look at keeping healthy patients healthier. It would be very difficult to measure making sure that our patients are exercising 5 days a week and eating their 7 to 9 servings of fruits or vegetables, because those things aren't measured. That is something that is missing in this current healthcare reform package. Our clients at Personal Care Physicians experience a greater level of care, partly because we don't have to carry as many patients. A typical practice will carry 3,000 patients, and with the current healthcare reform package, it's expected the doctors are going to actually have to take care of even a greater number. In our practice, we limit the number of patients we have to 350 patients. That allows me to have the personal time, the quality time with my patients. Probably the most important aspect for me is that I don't view myself as treating 350 patients. I view myself as treating 350 personal friends, and that comes with a much higher standard.